It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in today's episode I want to answer a question from one of my clients, Patricia. And Patricia has her 72-year-old husband in intensive care for 3 months now, and Patricia wants to know, my husband has been in intensive care now for 3 months on a ventilator with tracheostomy, and he is on dialysis. He can't be weaned off the ventilator. Can he go home? So Patricia writes, my husband, 72 years of age, had a right tibial artery blockage with loss of blood flow to his great toe. An atherectomy by a vascular surgeon was done on the 15th of August, and a nephrotoxic contrast media caused worsening of kidney dysfunction to stage 5, but gradually improved somewhat. Next hospital day, my husband had a heart attack or an MI and intermittent atrial fibrillation for the first time. Prior to that, he had a history of mild congestive heart failure. He was readmitted on the 28th of August for a right great toe amputation. Then he went back home again. After that, his kidney function deteriorated, and his third admission was on the 18th of September for uremia with mental confusion, and he was started on emergency dialysis. About 10 days later, he developed the first hospital-acquired pneumonia. It was slow to respond to antibiotics. After that, there was an acute and rapid drop in oxygen levels around 4 a.m. on the 4th of October, and he was finally put on a ventilator. The infectious disease specialist thought that probably it was secondary to a large mucus plug. My husband couldn't come off the ventilator for the next 2 weeks, and a tracheostomy and a PEG tube was done on the 20th of October. During the course of his intensive care stay, he developed a sacral pressure ulcer during his stay, which progressed markedly, and after debridement and removal of large amount of adjacent tissue, it's now a stage 3 pressure sore and wound, treated by wound care team, and has been on a Dolphus FIS bed. Now, the intensive care team then wanted to transfer him to a long-term acute care hospital, which I refused because I know that he is so much better off in an intensive care unit, especially with his ventilation and tracheostomy needs. A couple of weeks later, he developed a second hospital-acquired pneumonia. This time it was MRSA. He improved clinically with antibiotics, and his white cell count decreased from 28,000 to 18,000, but has never returned to normal. His white cell count on the 20th of November was around 14,500. Now, just for everybody that doesn't know what white cell count stands for, it basically is a marker in the blood for infections. Normal white cell count is 4 to 11,000, and anything above 11,000 really is a sign of an infection, right? His chest X-ray has shown bilateral pleural effusions, worse on the right, but also residual infiltrate in the right lung last week. He's had some chest drains for that to drain the pleural effusions. Presently, he's having hemodialysis 3 times a week with additional treatments added for fluid removal as needed. The lengthy ICU stay, multiple complications, and lack of adequate nutrition have resulted in extreme weakness. My husband remains primarily bedridden, except for being up in a chair for 2-hour sessions 1 to 2 times per day. he has continued to have paroxysmal atrial fibrillation, more frequent when he's extremely tired or stressed. In terms of ventilation weaning, my husband had worked up to 24 hours off 2 times, but then had to start over again because of the pneumonia and extreme fatigue. He has been on the tracheostomy collar for 3 16-hour sessions and 1 20-hour session this past week. Overall, it has been a difficult and delicate balance between adequate fluid removal and the extreme fatigue associated with dialysis, causing increased dyspnea. My husband had done well with trials of applesauce and diced peaches and will have a swallowing study done next week to further evaluate the possibility of feeding by mouth again soon. The current plan is to transfer him to a skilled nursing facility with a pulmonary unit that can take care of tracheostomy and ventilator patients and also do in-house dialysis. I am an advocate of holistic healthcare and would much prefer to have him at home instead and have the ability to add appropriate supplements to his treatments regime to strengthen his body and immune system. And in the meantime, my client Patricia writes further, because that's a while back, and now her husband is in a long-term acute care facility, and now Patricia writes, the LTAC has been as aggressive as they could be with weaning. The problem for him is his extreme weakness, balancing removal of fluid and dialysis, which are exhausting, and avoiding atrial fibrillation, which occurs when he is stressed, pulmonary, cardiac, and anxiety. He is now on his 3rd attempt. He had worked up to being off the ventilator at least 1 24-hour period 2 different times, and then he had to go back on the ventilator because of the 2nd hospital-acquired pneumonia and the arrhythmia issues with atrial fibrillation. This time he has done 3 consecutive 16 hours off and a 20-hour off, but just found out yesterday that he's being cut back again to 12 hours. And I am not happy, because I don't think the hospital is trying hard enough to get my husband off the ventilator. What do you think I should be doing next? Well, thank you, Patricia, for clarifying your husband's situation. It sounds like it's been a very long and tough situation for you and for your husband to be in hospital and in ICU for such a long time. Here is what I advise, really, Patricia. I mean, as you know already, your husband could go home with a service like intensive care at home, and that would be probably a good outcome for him and for you if he can't come off the ventilator. However, in the meantime, it's probably too early not to push for him coming off the ventilator, because, you know, it sounds like he's done the 16 hours already and 1 day 20 hours, so it sounds like he definitely has some reserves, but now it looks like they're not pushing hard enough. And from that perspective, you know, it's probably a fine line between mobilization. Mobilization is critical when patients are in intensive care and need to be weaned off the ventilator. It's not happening without mobilization. That's number 1. Number 2, you gotta continue the dialysis and make sure they can take as many fluids off as possible to offload any fluids from the lungs. And as you're aware, you know, if he's in pulmonary edema, he won't come off the ventilator. Now, he's had the heart attack, the MI, last year, and he's in chronic atrial fibrillation by the sounds of things, which also makes him more prone to potentially go into pulmonary edema, again, probably depending on how severe the heart attack was, depends on his ejection fraction. You know, you haven't mentioned that they've done an ultrasound or a TOE to check his ejection fraction. You haven't mentioned whether his AF is controlled. You know, did he have a cardioversion? Is he on amiodarone? Is he on digoxin? Is he in fast AF? Is he in slow AF? Is he in AF that's compromising his blood pressure? You haven't mentioned any of that. I assume that given that your husband can tolerate dialysis, that his AF must be controlled somewhat, because if he was to have a low blood pressure from the AF, he probably couldn't tolerate dialysis, or at least couldn't tolerate dialysis without inotropes or vasopressors. Next, you mentioned the nutrition status, and you mentioned that your husband seems very weak. Now, after months in ICU, after months of intensive care treatment, after months of probably a disturbed day and night rhythm, after some weeks in an induced coma, many patients unfortunately are very weak when they come out of this situation. And again, adequate nutrition is important. I mean, it sounds like he's got the PEG. It sounds like they've done some swallowing tests already. Adequate nutrition is very important. And also, as I mentioned, mobilization is very important, because without mobilization, he can't strengthen his muscles, he can't strengthen his body. And also, imagine if he's not sitting up, if he's not getting mobilized, it'll be very difficult for him to train his respiratory muscles and breathe by himself, and breathe more and more by himself, so that he can stay off the ventilator 24 hours a day. Once he manages to stay off the ventilator 24 hours a day, then the next step is to get him off the ventilator and stay on the tracheostomy collar 24 hours a day. Then looking at frequency of suction, looking at how much oxygen does he need, does he have a good strong cough, can he follow simple commands, and then if he has a good strong cough, then hopefully the next step is to take the tracheostomy out. But it sounds like he's a bit away from that. The other thing you always have to keep in mind is, for example, if your husband doesn't come off the ventilator, do they not want to send him away? Do they want to keep him there because they want to keep earning the money? You got to ask those questions. And I know some people watching this might think this is too far-fetched. Well, I can tell you that after I have worked in the industry for over 20 years, you'd certainly have to ask those questions, whether they potentially want to keep your husband in this facility to make money. So, Patricia, you know what you need to look for. Again, mobilization, get the fluids off with the dialysis, keep doing those weaning trials, breathing exercises, physical therapy and physiotherapy, so that he can get trained to get off the ventilator. And here's the thing, if all of that fails, yes, absolutely, you should go to intensive care at home, and you should check out intensivecareathome.com as a next step. But for now, keep pushing to wean him off the ventilator, because going home will be so much easier without the ventilator and without a tracheostomy. Yeah, it can be done. Ventilation, tracheostomy at home can be done, and weaning can be done at home as well. But it sounds like your husband may not have that far to go to get off that ventilator, and then going home is so much easier. So that is really my advice at this point in time. And if all that fails, come to intensive care at home, and you can find more information at intensivecareathome.com, and then go home from there. So those are the next steps, Patricia. Thanks again for being a client, and thanks again for giving me the opportunity to help you with this. So how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions and get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone, via Skype and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you next week in another update.